Hello everyone, today we're going to be walking through a demo video of Trusted American Insurance Agency's quoting tool. We'll be going over the tools of Medicare Supplement, Medicare Advantage, and as well as the e-application for Medicare Supplement. To start a new Medicare Supplement quote, we'll start by clicking Run Quote. After clicking Run Quote, we will see the parameters page pop up where we can enter all the quote parameters for the results we'd like to see. So we'll start by entering our zip code, select our age, anywhere from under 65 all the way to 99 years old, our gender, tobacco status, plan type, and how we'd like to sort the results by. We can choose price, which would mean least expensive to most expensive, AM Best rating, SP rating, or company name, meaning alphabetically. We can also choose the effective date. This will default to today's date. However, if we'd like to see any rates that would go into effect between now and a certain date or on a certain date, we can certainly move that effective date out. So maybe we want to see any rates that would go into effect on 7/1, so we can move that out. And we can also choose whether or not we'd like to apply the household discount. We can also click Show Advanced. This will open up our Underwriting Filter feature. This is where you can add in a person's health conditions or medications, and it will tell you which carriers do not have those health conditions or medications on their knockout drug list or automatic decline list. We'll start by choosing a health condition. We can search any health condition we'd like. We'll select heart attack, and we'll say the event occurrence was less than 5 years ago. Once we select our health condition, we'll click Add Filter, and we'll see that health entry added below. We can do the same with medications. We can select any medication, select the associated condition if that is an option, and then we can click Add Filter. If we want to remove any filter, we simply click this X, and you can add more than one health condition and medication at once. Once we've entered everything the way we'd like it to be added, for our quote, we can hit Get Quote. Now, since we did add in a health entry, it is only going to show results for carriers that would potentially accept this health condition. So again, carriers that do not have this health condition or medication on their knockout drug list or automatic decline list. So as you can see, it says carriers listed below accept the following health condition or medication, and it has heart attack here that we selected for past 5 years. We can also remove that filter, and then this will show us 100% of the results. You can see we see our results here listed from least expensive to most expensive. We see the monthly premium and carrier name, as well as a household discount and policy fee if there is one. We can also see the parent company, AM Best rating, rate type, plan type, S&P rating and rating class if there is one, the years in market, and the effective date of this particular plan. We can also click Plan Details in order to see the Part A and Part B plan details. We can click PDF Application, and it will download the PDF application for us, and we can view this document. So for some reason we need to get that PDF application, and it's loaded in here. We are able to download that, so we can see here we have this Aetna application. We will get a pop-up anytime a new carrier is added for the e-application. So that's what we're seeing here in this window. We're seeing that we currently have this for Continental Life Insurance Company of Brentwood, Tennessee, and United World Life. So I'm going to hit OK. We also have a Social Security Office Locator, so that will open up that web page and take us to that website. We also have a link to Medicare.gov. And we also have this Carrier Resources button, which will link us directly to the carrier's login page. Lastly, the Apply Now button is what we're going to use for the e-application that can be done on this platform. We'll get to that in just a minute. On the left-hand side, we can adjust our view by expanding the quotes, which it's expanded now, or contracting these quotes, so it just shows the premium and carrier name. We can choose to apply the discount, which is a household discount, so we can see it changes that rate as we click Apply Discount. We can see annual rate, market analytics, which is age increases, increase history, and market data. For the age increases, this shows us what the current rate is for the age listed here below. So whatever age we run the quote for, so in this instance a 65-year-old, it will show the next 4 years and what that current rate is for that age, so we can anticipate how the plan premium may increase as the person ages. The increase history shows the past increases or decreases this plan has taken, and the market data is our NAIC data. It shows both on a national and state level the number of lives that are covered, the premium amount, loss ratio, and market percentage. If we ever want to see where this data is coming from for these market analytics for these 3 pieces, we can scroll down the left-hand side and click About Quote, and we get this nice little cheat sheet that shows us what the source of each of these pieces of data is, as well as the definitions. So it's always a good reference point. We can also decide if we would like to do an export of this entire quote list. So, for example, we may want to export every single plan that's listed here. So in this case, we could either choose to do a print, a PDF, or an Excel download of this information here, or maybe we just want to see a few carriers side by side. If I click on this red bar at the top, notice it turns green and populates under Compare Quotes. So I can select up to 5 plans at once to compare side by side. I'm going to select 3 for this example. After selecting my plans and they populate under Compare Quotes, I'm going to click Compare Quotes, and we will see just these 3 plans side by side for a comparison. So we have each of our companies listed here. We can also choose to do a PDF export or print export of just these 3 that we chose to compare. If for some reason we need to remove one of these 3 carriers, or we want to compare a different set of carriers' plans side by side, all we need to do is just click the little X next to it under Compare Quotes, and it will remove those plans. We also have application health questions. So under application health questions, we can select any sort of health condition that somebody may have. So again, we have the underwriting filter, which will actually filter out our results. Or if we click something such as heart attack, we can see it populate here, and we can see that the look back period is 1 year. So it's going to show us on the application, does it ask if they've had a heart attack in a certain amount of time frame? We can see for this Continental Life Insurance Company, they ask on the application if the person has had a heart attack in the past year. So it's just going to go off of those questions that are asked on the actual application. So we have 2 different ways we can add in health conditions there, the underwriting filter and the application health questions. Okay, so that covers the Medicare Supplement quoting tool. We're going to go ahead and move into the Medicare Supplement e-application. So in order to start a new e-application, we can click, again, this Apply Now button that's listed under any of the carriers that offer it. So we have Continental Life Insurance Company of Brentwood, Tennessee, and we also can see that we have United World Life. I'm going to click Apply Now under United World Life, and it's going to take me directly into the e-application. So you're not having to leave to go to another website or log in. It's all done on this platform. So by clicking this Apply Now button, it's taking me right into the e-app on this platform, and we'll fill out the e-application and it will be submitted directly to the carrier. After we click this Apply Now button, it's going to open up, and for the very first time that we're running a quote for a particular carrier in a particular state, we will need to validate either our producer number or our writing number depending on the carrier, as well as our first and last name. So you can see today, for this demo example, I'm David Perlberg, and my producer number is populated because I've already done an application in this state for this carrier, so it is remembering me. I have gone through and filled out some of these sections, so we can move through this e-application, but we'll walk through each of these sections together. So you can see that it automatically carries the quote details over, so we have a Plan G, the premium, gender, age, and tobacco status. We can also download initial documents, such as the outline of coverage, guide to health insurance, terms and disclosures, or applications. We can select our underwriting type, so full underwriting, open enrollment, or guaranteed issue. And this is a smart e-app, so if we select maybe open enrollment and we don't qualify for an open enrollment period, we will be notified of that. For today's example, I have selected open enrollment. I've entered my date of birth for my client, the client's date of birth, whether they're covered under Medicare Part A and Part B, what those effective dates are. We'll go ahead and click Continue. And you'll notice as you move through the e-application that as you complete a section, you will get a green check mark. Again, I have pre-filled some of these sections so we can move through it today for the demo. You can either click this continue button to move to the next section, or you can just click directly on the section to jump to a section of your choice. This is the applicant information. We can choose where we heard about the carrier, what our plan type is. So if we were to switch this, it would automatically update the premium in real time. So it is a smart e-app. And of course, I don't qualify for, my client does not qualify for Plan F, so those are grayed out here. It carries over my effective date of the quote. Enter your first and last name and your address, as well as your contact information. If you are going to be doing an e-signature method using the email version of the signature method, it's very important that you enter your applicant's email address here, and it is entered completely correct. So you don't want any typos, because then it won't be sent to the correct email address. So double, triple check your email address, the client's email address, so that they can sign it. It's going to ask us about tobacco use. Again, we said non-tobacco. If we were to switch this to yes, it would adjust our price if it would do so. We can choose to receive our explanation of benefits, and if we'd like to go paperless, and if we'd like a temporary Medicare Supplement ID card. So I went ahead and said no for each of those. We're going to be moving to the household premium discount information. So it's going to be asking us, based on the carrier's rules, if we qualify for a household discount. So let's wait for this to load here. And now the definition of the household discount will be listed, and it will ask if we qualify for this discount. Again, if we select yes, it will change our premium amount for us, and it will ask us the questions relating to the household resident that would qualify us for this discount. So again, it updates in real time. We're going to go ahead and say no, that we will not be adding a household discount, but I want to show you how it does adjust in real time and how we can see that if we do select that, it will update the price for us. So there's no confusion about what the price is going to be or how it will affect the price. It will automatically reflect the correct price based on the information we enter in this application. So no surprises at the end that the price would be different or anything to that nature. It's all going to update in real time. The same thing would go if we were doing a full underwriting application. So as we would add in a person's medications or health conditions for a full underwriting example, it would let us know if we've entered a health condition that would be an automatic decline, and those notifications would be populated up here at the top. So for example, if we entered a health condition or medication that was an automatic decline, we would actually see something here that would say declined, and the applicant is not going to be approved for coverage. So it saves the agent and the client time so that they're not having to submit an entire application and then come to find out that they've entered something that would be a decline. So it underwrites in real time for those full underwriting applications, again, saving time for both the agent and the client. The next section we have here is the Medicare information. So as you can see, as we move through the application, it's very simple and easy to use. We're just clicking continue. It walks you through the entire application. So when you're going through it, you're not confused what section you're on. It highlights your section, makes it really easy to follow through. So we'll enter all of our Medicare information, Social Security number. If we're covered under Part A and Part B, it carries this information over since it did already ask us these questions. So it carried that over for me. And it's asking for during an open enrollment period. So we said yes, and we have not enrolled in Medicare Part B in the past 6 months. Previous or existing coverage information. It's going to ask us if we're covered for medical assistance through the Medicaid program. We've said no. If we have another Medicare supplement policy plan in force, we said no. And if we've had coverage from any Medicare plan other than Medicare Part A or Part B within the past 63 days, we selected no. And if we've had coverage other than under any other health insurance in the past 63 days, again, we're saying no to that. So we've gotten through all these questions about the actual application piece. Now we're on the method of payment. So if we would like, we can actually mail in a check if we're doing a wet signature method. So we can actually download a PDF of this application. It's been created the entire time we're moving through the app. So we could actually do a PDF download and we could send it in for a wet signature application if we would like. However, since it is an e-app and that's going to be most likely how you're going to be submitting the business, we're going to go ahead and say no. So if we do not do a wet signature, we cannot do a check. In that case, we do an automatic bank account withdraw, and we'll select our checking. We'll select our routing number and our account number that it will be automatically drafted from, as well as the first and last name on the account. We can also choose if we'd like to do a direct bill, but we're going to stick with automatic bank account withdraw. And we can choose a particular day, and I've went ahead and selected the first day of each month. So once we've entered that method of payment or that banking information, we're going to have the section here to be completed by producer. We can choose where we'd like the policy delivered, the applicant or producer. We're going to state that we've accurately recorded the information in the of the applicant, and we've interviewed the proposed applicant. We can also add any notes to underwriting that we'd like to add here, or upload any documents, so a notice of termination or evidence of insurance, and choose those files so it will be directly uploaded with the application. Once we've entered all this information, we'll click Verify Application. This is our last chance to kind of take a look at all the information we've entered. We can see that we have these green check marks saying that the application is completed for these sections, but if we happen to notice something that we mistyped or we'd like to change, we can click Edit Section, and it will take us right back to that section to change anything we'd like to. At this time, we can either print for a wet signature or we can do a lock and e-sign. So as a producer, I'm going to lock and electronically sign the signature on the application. And this just means that now I cannot go back and change anything without letting the client know or notifying the client. So we're going to go ahead and hit I agree after these terms and conditions. And then this is the statement of signature here. So it's going to ask if we are in the same physical location as our client. Someday if we are, we can click yes, and then they can actually just provide their mother's maiden name and the last four of their social security number. If we're not in the same physical location, we'll select no, and again, it will be emailed to this email that we entered earlier on in the application by sending an email signature link. If we choose email signature link, it's going to email the applicant two things. It's going to be one email, and it's going to include two things: a link to the signature page and a verification code. All they need to do is click on that link and enter the verification code from the email, and that would suffice as their signature. Because we're on a demo today, I'm going to say that we are in the same physical location, and we're going to provide identifying information just so I don't have to go retrieve that email. But it is very simple. Again, they will receive one email with a link and a verification code. They just need to click on that link and enter the verification code for their signature. We want to be sure to open each of these required documents and then state that we've read, received, and kept a copy of all the important documents above. And then this is a signature for the applicant. So mother's maiden name and last four of the social security number. We're stating that we're signing in Omaha, Nebraska, and then we'll click Apply e-signature. Now this is the actual producer, the agent signature. So they would sign by entering their first and last name and their producer number. So we'll click Apply e-signature and Sign Application. Now we can see that the enrollment application is preparing the application. We have these documents. Again, if we forgot to download these documents or we need to get another copy, they're all listed here. We can certainly download each of these. And as it's preparing the application, it's going to actually produce a policy number for us. So we will walk through where this application would be saved in your dashboard so you can see any applications that you've started and maybe not completed, or any completed applications. So it stores them all in one nice place for you. Again, it's submitting the application for us, just takes a minute, and it's going directly to the carrier right now. Again, we can return to applications, but I just want to show what this would look like once it's submitted. We would get this policy number here, so it says, "Thank you for submitting a Medicare supplement application to United World Life Insurance Company. Please reference policy number," and it lists it here. So I'm going to return to applications. I'm going to take us to our application dashboard. This is, again, where you have any applications that are currently in progress or that have already been submitted. So you can see this one I started and did not complete, and it says the date that it was created and modified. I can go back in and edit this application or continue, or I can click this delete button to remove it out. This is the one we just submitted here. You can see the status shows as submitted, and we have our policy number listed. We can also view the PDF application, or we can see additional updates on the agent portal by clicking this button here. So I'm going to take us back to the initial dashboard. That was our Medicare Supplement e-application. And now our last piece is to walk through the Medicare Advantage quoting tool. So in order to start a new Medicare Advantage quote, similarly to how we did for the MedSup, we'll just click Run Quote. We'll enter our zip code, select whether we'd like to run a Medicare Advantage, Medicare Part D, or Special Needs plans, choose if we'd like to filter the plan type. I'm going to select All, choose our effective year, and choose how we'd like to sort, either by price, least expensive to most expensive, or by company name. And we have a new filter, a low income subsidy level filter, where we can actually choose the low income subsidy level, and it will filter our results by that information entered. I'll go ahead and hit Get Quote once we've entered everything. And many of these plans for Medicare Advantage are going to be a $0 premium. So in that case, it sorts by max out of pocket. So we can see the lowest max out of pocket all the way to higher, the highest max out of pocket available. We can see the company name, the plan, star rating and drug deductible, drug benefit and plan type, gap coverage, county, and also the plan ID. Again, we have our links to our plan details, Medicare.gov, Social Security Locator, and our Carrier Resources button, which actually pops up the physician lookup, the formulary website, and pharmacy website for this plan. So we can actually link right into the carrier's physician lookups, pharmacy website, and formulary website by clicking this Carrier Resources button. Again, we can do the expand or the contract of the quotes. We can see the annual rate and market analytics. So for Medicare Advantage, it's showing the county penetration, the number of people that are eligible and then enrolled, what the penetration percentage is, and that's total for the county. And then we can also see for the particular company what the number of people enrolled in penetration percentage is for this particular company. Again, we can filter by this low income subsidy level, so we can select that. We can do the compare quotes as we did for the Medicare supplement, so selecting up to 5 plans at once and clicking compare quotes to see a side-by-side comparison of these 3 plans, up to 5 of them. We can show or hide additional details. We can do a print export or a PDF export of just these couple plans we have here. Or again, for that entire list, we can actually do an export, and we can see 100% of the carriers that are listed in a nice, concise export. So I'm going to go ahead and clear these out for us. And again, we could do the print or the PDF or the Excel download of this entire list. I'm going to show you a quick example of the PDF here. So I'm going to click PDF Export, and I'm going to show you where you can actually update your personal information. So if you are running a quote for somebody and you'd like to either email them the quote or you'd like to mail them the quote, I'm going to show you what this PDF looks like and how you can update your personal information that is shown on the PDF export. So we'll wait for this export to load here. Just making a download of everything that's listed. So again, we're going to have all 18 plans here. We'll click this quote and we can see that it lists the agent's name, phone number, email address, and the quote that we ran. It also has your picture. So if you would like to update this information, you'll go to your dashboard and you'll click on your username up at the top, upper left-hand corner. And this is where you can update your first and last name, phone number, choose a picture if you would like. This picture would be on your export. Choose your agency name and enter your website if you would like, and go ahead and save that information so that you have a nice, professional PDF export that you can email, or mail to your clients. Thank you so much for watching today's demo. Have a great day.